I'm Megan Edwards with the ACR Bulletin, and I'm here with Dr. Frank Lexa, Chair of the ACR Practice Leaders Meeting. Dr. Lexa, thanks so much for being here.
Well, thank you for having me.
What do you hope attendees take away from this year's meeting?
Well, certainly, I hope they take away several things. Certainly, the notion that they're not alone. I think that, given how diverse our country is, I think sometimes there's the fear or the notion that this is just affecting me and my locality. And certainly, one of the things that they can take away is understanding how other people in radiology are reacting to these things. I think it's also important to understand the central role that the ACR has in trying to help all of us and sharing best practices and providing support to all of us who are working at a very challenging edge of radiology. And certainly, I hope they take away something that we have at every practice leaders meeting, which is the notion that there are actionable things that they can do as soon as they get home to help their practices succeed in a very challenging time.
So, do you think leadership is something that can be learned?
I absolutely think it's something that can be learned. It's one of the reasons that I've been very interested in the Radiology Leadership Institute in the ACR. And I sometimes tell people, and it's really not much of a joke, although I say it in a joking way, that if it can't be taught, then certainly some of the business schools where I work are some of the best scams going on the planet, because they teach leadership. And they teach leadership to people who are already, for the most part, at least in many cases, are already very good leaders. But we can teach leadership to people who aren't leaders, and we can help leaders become better leaders. So I absolutely believe that it can be taught. I don't think it's something that's just in your genes or it's just something you're born with. I think it really comes down, in many cases, to just learning the skills and then putting them into practice.
Can you name a few areas where leadership in particular is needed in radiology?
Well, certainly I think one place where it's needed is the area we just mentioned, which is that I think it's important to see young people taking on leadership roles. I think that's one of the key areas where it's needed. I think it's also important to see radiologists, gently at least, trying to lead non-radiologists. Certainly one of the themes that's embedded in many of the types of change that's occurring in healthcare right now is the notion of healthcare in teams. That instead of each of us just doing our little piece for the patient, that we do a better job of working together, coordinating care, communicating important information, making the kinds of judgment calls that involve interacting with other physicians and other types of healthcare workers. And so certainly that's an area where we need more leadership. If you have seen a family member in a hospital in the last couple of years, or you've had the experience yourself being a patient, it's probably safe to say that more likely than not, you saw examples of how the healthcare system could work better for the people who matter most, which are people who are ill and people who are frightened or people who are both. Our patients and the people who care about them, their family members and their friends. So certainly it's an opportunity to work on issues like that and develop better forms of coordinated care. That's another area where I see a tremendous opportunity for leadership. And then certainly in the formal structures that are involved in the shift from volume to value. Since these are relatively new organizations, they're just finding their way, and they're all in forms of evolution. And so certainly whenever that kind of thing occurs, there's a tremendous leadership opportunity, because quite frankly, no one in America has 20 years of experience of successfully leading an ACO. They're too new, and to put it bluntly, many of them have had trouble finding success. Not all of them have succeeded. So tremendous opportunity there for a smart radiologist, for him to take on a role in actually helping the hospital make that transformation successful.